High ankle sprain physical therapy treatment. As part of the AllSports Medicine team, physical therapy will work to rehabilitate your ankle to get you back on your feet and able to return to your sport or activities at full capacity as soon as possible. First, the physical therapist will assess joint alignment and joint stability. They also use modalities such as electrical stimulation in addition to ice to assist with pain and edema or swelling management. After the pain and swelling have improved, in physical therapy you will begin an exercise program to improve your ankle's range of motion and flexibility. After your range of motion has improved, strengthening, balance and proprioception exercises are introduced. In the last stage of rehab, return to sport-specific exercises are begun for preparation to return to sports with a focus on prevention of re-injury. Your individualized program will be designed specifically to address the needs of your sport or sports. These often include plyometric or jumping activities and agility activities such as running and cutting. We emphasize proper movement patterns, alignment and biomechanics to address all the needs of the athlete in order for safe return to sport. Physical therapy at Johns Hopkins All Children's is provided in an atmosphere developed for teen athletes with a 1-to-1 ratio for the highest quality of care needed for maximum outcomes and return to play. AllSports physical therapy will get you back in the game. Physical therapy in the treatment of sports injuries. Exercise and physical activity are very important to maintain a healthy lifestyle, but it is a fact that strenuous physical activity greatly increases the risk of soft tissue damage, ligaments, muscles and tendon, and bone injuries. The primary and secondary mode of therapies differs depending upon the nature and cause of injuries. In traumatic injuries, a more intensive surgical or medical therapy is needed, but since most sports injuries are minor sprains, muscle pulls and ligament injuries that do not require any medical or surgical intervention, physical therapy alone is the best mode of therapy in majority of the cases. Moreover, in case of surgeries that involve major joints, rehabilitation is needed to improve healing and blood circulation, which makes physical therapist an integral part of any sports team. Some common sports injuries for which physical therapy is very helpful include abrasions, perhaps the most superficial and common forms of injuries. Ankle sprain is also another common and apparently simple form of sport injury that can occur when athletes perform vigorous activity without performing warm-up exercises. Tearing of ligaments, ACL being the most common, is another injury that may limit the degree of movement across the knee joint and can affect the sports career of the athletes. Hamstring pull or strain or tear is reported frequently in running sports, and the injury may be as minor as a sprain to as severe as muscle tearing. Bone fractures are also very common in athletes and require stabilization via surgeries, splinting and other modes of interventive care. Athletes have a very limited scope of undergoing major surgeries, and most of the athletes avoid adopting interventive medicine for a number of reasons, like delay in healing that affects the performance and form of players, risk of damage to major or minor nerves and vessels as part of iatrogenic trauma, or prolonged disability that limits the athlete to perform in sports activities. Regular physical therapy in sportsmen improves range of motion across the joints, flexibility of muscles, and promotes fitness as a whole by warming up muscles. It also helps in the development of small muscle fibers that are missed out in gym exercises. It's the best mode of therapy for all age groups and all sports personnel that is equally effective in male and female players. Physical therapy serves at stabilizing the tissues in the natural biochemical environment and helps in promoting blood circulation. Rehabilitation after any surgery, and primarily sports surgery, requires restoration of physical mobility via physical therapy that decreases the pain by washing off the pain-producing mediators and hasten tissue recovery by restoring optimal blood circulation across healing tissues. Physical therapists are an essential part of all sports teams to enhance fitness in the team and to take care of minor tissue injuries to decrease the risk of inflammation-related tissue damage. Physical therapists serve these important functions by sports education that serves to educate professional sports players regarding warm-up exercises, tissue-relaxing exercises, and massage to prevent soring of muscles. Education regarding appropriate postures during and after sports activities. Machines and devices that promote blood supply to tissues, joints, muscles and bones, and muscle strengthening exercise that stabilize tissues and provide support to ligaments, tendons, and other parts of musculoskeletal system.